Hello, my name is Żaneta Michalak and I'm a dietitian and food lover. Today I will present a topic on vitamin B12, specifically a topic related to vitamin B12 deficiency. This is an issue of great importance to health which everyone should have knowledge of. Because did you know, for example, that with vitamin B12 levels in the normal range, you can have symptoms of vitamin B12 deficiency? And this can be quite serious. By watching today's entire video, you will learn how harmful vitamin B12 deficiency is to our health or what symptoms it can cause. I will of course say who is particularly at risk of vitamin B12 deficiency and who, right after watching this video, should determine the level of vitamin B12 in the body by taking a test. I will also devote a few words to the established standards for vitamin B12 as I believe they are too low. There will also be information on how much to consume and how much to supplement vitamin B12 to guard against unpleasant health consequences. I don't want to forcefully urge anyone to watch the entire episode, but I think that these several minutes can help many people. First, let me briefly say what vitamin B12 is and its basic functions in our body. Well, vitamin B12 is a water-soluble vitamin, the characteristic of which is that it contains cobalt in its molecule. And for this reason, the various chemical forms of vitamin B12 are called cobalamins. And we have several forms of these. The most popular are two: methylcobalamin, the active form of vitamin B12, and cyanocobalamin, which does not occur naturally in nature. I will say a little more about them later in the video. The second very important point about vitamin B12 is that, except in isolated cases, it naturally occurs only in animal products. I am referring to fish, seafood, meat, eggs, and dairy products. It should also be emphasized that in order for vitamin B12 to be absorbed from the gastrointestinal tract, it needs the presence of a so-called intrinsic factor, otherwise known as Castle's factor. It is a molecule secreted by stomach cells that combines with vitamin B12 and helps it enter the bloodstream. Without the Castle factor, vitamin B12 absorption is very inefficient and almost impossible. And then, supplying it through the oral route is of a little use, at least if we are talking about administering small amounts. Vitamin B12 has a number of important functions in our body. First of all, it is essential for the production of red blood cells or erythrocytes and thus prevents anemia. Vitamin B12 is also extremely important for our nervous system as our body uses it to produce the myelin sheath, which protects the neurons or nerve cells from damage and ensures proper conduction of nerve impulses. In addition, vitamin B12 is involved in the formation of neurotransmitters. It should also be noted that vitamin B12 mediates the conversion of homocysteine to one of the amino acids, namely methionine. In this way, it lowers homocysteine levels in the blood. And here I will point out that this is a very beneficial effect since too high a concentration of homocysteine in our body contributes to cardiovascular disease, among other things. Vitamin B12 is also involved in many energy processes that produce energy. Thus, ensuring adequate amounts of vitamin B12 can help reduce feeling of fatigue and tiredness. After this brief introduction to the topic, I would like to move on to discuss what is most important: vitamin B12 deficiency. Very often, the symptoms of vitamin B12 deficiency are downplayed or attributed to other diseases. It is extremely rare that when a patient lists the symptoms that bother him, it is the doctor who links them to a deficiency of this vitamin. However, in this case, doctors cannot be accused of lack of competence. It is just that many of the symptoms of a lack of vitamin B12 in the body are non-specific, which means that they can indeed indicate many other ailments. Literature data show that up to about 10 to 15% of people, or plus or minus 1 in 7/10 of people, suffer from vitamin B12 deficiency. However, it should be noted that the prevalence of vitamin B12 deficiency increases with age. For example, older people are more likely to face this problem. I would also add that I have reviewed many scientific publications of vitamin B12, and based on them, I can say that the number of people suffering from a lack of it is probably underestimated. This is because in many cases, people whose vitamin B12 levels are within normal limits experience symptoms of vitamin B12 deficiency. I will talk about the established reference values for vitamin B12 levels in a moment. I will now outline the most important symptoms associated with vitamin B12 deficiency. Unfortunately, the lack of this ingredient takes its toll on our health in many important ways. First of all, the cardiovascular and the nervous systems are affected, but not only. The mildest symptoms that may indicate a lack of vitamin B12 are gastrointestinal symptoms. These include nausea, constipation, and diarrhea in particular. But let's say such symptoms are not a big problem and can indicate many other ailments. Far more troublesome is anemia, which insidiously develops in the absence of vitamin B12. The most common symptoms of this are loss of appetite, weight loss, fatigue, weakness, headaches and dizziness, pale skin with a yellow tint, and tachycardia or accelerated heart rate. The symptoms are very similar to those of anemia caused by iron and folic acid deficiency. Therefore, if you suspect yourself of being anemic, you should determine in your blood not only iron and other parameters related to iron metabolism such as ferritin, but also folic acid and just vitamin B12. In addition, it is a good idea to perform a blood test since vitamin B12 deficiency anemia is characterized by the presence of red blood cells of abnormally large size, which are called microcytes or megaloblasts. For this reason, this anemia is referred to as microcytic or megaloblastic anemia. This parameter can be found on the blood result sheet under the abbreviation of MCV, in which case the result is too high. Neurological disorders that result from vitamin B12 deficiency are particularly dangerous. As I mentioned earlier, vitamin B12 participates in the formation of the myelin sheath that surrounds nerve cells. Its absence impairs this process. As a result, peripheral neuropathy develops. Initially, there are symptoms such as tingling and numbness in the extremities, as well as stinging in the pads of the toes. If adequate amounts of vitamin B12 are not provided in time, these symptoms can develop into sensory disturbances and weakness in the legs and arms, which very often occur in conjunction with pain and are accompanied by, for example, gait instability. In isolated situations, visual neuropathy might develop. By this, I mean deterioration of vision and even loss of vision. One such characteristic symptom of vitamin B12 deficiency on the part of the nervous system, which however does not necessarily occur in every person, is the so-called Lhermitte's sign, also known as Lhermitte's phenomenon and the barber chair phenomenon. It involves feeling a current that runs along the spine as you tilt your head forward. Lack of vitamin B12 also causes cognitive dysfunction. People who have low levels of this vitamin may develop memory and concentration disorders. But it doesn't stop there. People affected by vitamin B12 deficiency that goes untreated are more likely to develop neurodegenerative diseases, including dementia, Parkinson's disease, and Alzheimer's disease. Deficiency or low levels of vitamin B12 can cause sluggishness, apathy, mood disorders, anxiety, restlessness, and depressive symptoms. What's more, it seems that it can also exacerbate the course of schizophrenia. There are also a number of other additional symptoms that can occur in the course of vitamin B12 deficiency. One of the characteristic symptoms is the appearance of the so-called buffalo tongue. What does it mean? In some people, the tongue becomes shiny and smooth. In addition, mouth and tongue ulcers may occur, often accompanied by pain. In some cases, hyperpigmentation or excessive skin coloration, such as on the feet or hands, is also observed. This is probably due to excessive melanin production. Interestingly, researchers also suggest that premature graying of hair may occur as a result of vitamin B12 deficiency. So as you can see, a lack of vitamin B12 can lead to serious problems in our bodies. At this point, I want to emphasize one very important thing. Well, symptoms from the gastrointestinal tract, circulatory system, nervous system, or skin changes do not have to occur simultaneously. They can appear gradually and in varying degrees of severity. Hardly if there are high amounts of folic acid in our system, it can mask the hematological problems of vitamin B12 deficiency. In other words, if you suffer from a lack of vitamin B12 and have plenty of folic acid instead, you are unlikely to develop symptoms associated with anemia. In the meantime, insidiously, deficiency of this vitamin can worsen, leading to damage to the nervous system. Therefore, if you notice only some of the symptoms I mentioned above in yourself, such as those related to the appearance of the skin, tongue, vitality, my request is that you do not underestimate them. Many of these symptoms subside with vitamin B12 supplementation. However, if we allow the deficiency of this vitamin to get worse and ignore it without doing anything about it, irreversible changes in the nervous system can occur. Hence, if the symptoms mentioned above occur, it is a good idea to go for testing of vitamin B12 levels right away, even without consulting a doctor first. It is enough to perform them prophylactically once or twice a year. Vitamin B12 deficiency can occur in any of us, as it does not depend only on our diet but also on a number of disorders and diseases that, among other things, impede the absorption of this component. This means that even if we consume food rich in vitamin B12, we may still suffer from its deficiency in some situations. Now, I will briefly discuss the most important cases that predispose to vitamin B12 deficiency. If any of these apply to you, then all the more reasons for me to suggest that you check yourself for levels of this vitamin in your body. Vitamin B12 deficiency is primarily threatened by vegans. This is because, as I mentioned at the beginning of the video, vitamin B12 is only found in animal products. The human body has some reserves of its vitamin, but at best they will last a few years, not a lifetime. Hence, people who do not consume meat, fish and dairy products should supplement vitamin B12. I suspect that there may be comments that, after all, the intestinal bacteria in our body produce vitamin B12 and why therefore it is necessary to provide it, for example, from supplements. Well, it is true that vitamin B12 is produced by the bacteria that inhabit our intestines. However, it is important to note that this production takes place in the large intestine, while the absorption of vitamin B12 takes place in an aerial section of the intestines, specifically the ileum. And in the face of this, our body can benefit little from this immature production. Vitamin B12 deficiency can also occur due to a lack of intrinsic factor or Castell factor, which is responsible for the absorption of this vitamin from the gastrointestinal tract. Such a situation occurs mainly in people suffering from Addison-Birman disease, otherwise known as pernicious anemia. It is an autoimmune disease in which the stomach cells responsible for the production of intrinsic factor are damaged. A similar effect may occur in people struggling with atrophic gastritis. In such cases, even despite providing the recommended amounts of vitamin B12, our body cannot make very good use of it. Insufficient vitamin B12 levels can also be caused by all those diseases that are associated with nutrient malabsorption. Well, if you suffer from celiac disease, Crohn's syndrome, inflammatory bowel disease, have been diagnosed with Helicobacter pylori infection, or if you have had a resection of the stomach or ileum, the section of the gastrointestinal tract where vitamin B12 absorption occurs, it is likely that you may be deficient in this nutrient. Certain conditions associated with vitamin B12 malabsorption occur in the elderly. Therefore, the older we get, the more at risk we are for vitamin B12 deficiency. This is especially true for people over the age of 60. Vitamin B12 deficiency is also observed in people suffering from chronic pancreatitis. This is because when the pancreas is inefficient, it produces fewer enzymes needed to release vitamin B12 from certain connection in which it is found in the duodenum. As a result, it can be said that then such bound vitamin B12 cannot be absorbed and perform its functions in the body. The cause of vitamin B12 deficiency in the body can also be caused by taking certain medications. This problem particularly affects users of metformin, one of the most popular diabetes drugs, In addition, low vitamin B12 levels can occur in people taking proton pump inhibitors, such as omeprazole, or as a result of histamine H2 receptor antagonists, such as cimetidine and ranitidine. These are agents typically used for gastric and duodenal ulcers, as well as gastroesophageal reflux. Here, I emphasize that if you are using any of the mentioned medications and it turns out that you have vitamin B12 deficiency, then you should not discontinue them on your own without consulting your doctor. It is probably enough if you additionally reach for preparations with the missing vitamin. Given all this information, if you eat little meat and animal products, suffer from any of the aforementioned diseases, are taking the aforementioned medications, are over 60 years old, or if you are experiencing the worrying symptoms I mentioned earlier, then I suggest you don't delay and go to get your vitamin B12 levels tested in your body. The basic test is to check the concentration of vitamin B12 in the blood. As I mentioned, it is a good idea to perform them preventively, once or twice a year. However, this test is subject to some errors, and that's because the level of vitamin B12 in the blood does not fully always reflect the actual concentration of this component through our bodies. Hence, if we get a result on the borderline of normal, it is a good idea to perform additional tests. But I will talk about them in a moment. Now let's still focus on testing the levels of vitamin B12 in the blood. Well, there is a problem with setting standards, or in other words, reference values. A range of 200 to 1000 picograms, abbreviated as PG, per milliliter, or 200 to 1000 nanograms per liter, is considered a normal blood vitamin B12 levels. However, getting a result at the lower end of the norm or even slightly above should not be cause of optimism. Literature data show that a result of even approximately 300 to 400 picograms per milliliter may be insufficient to prevent the development of vitamin B12 deficiency symptoms. That's why I recommend to my patients that they follow a diet or take vitamin B12 preparations in such a way that they get a result above 400 picograms per milliliter, and preferably it should be at the upper limit and reach about 800-900 units. If you get a result in the normal range but less than 400 units, it is worth performing 2 additional tests. I am referring to the determination of methylmalonic acid and homocysteine levels in the blood. I don't want to elaborate too much on this study, but I will just say that the levels of these components are very sensitive to the amount of vitamin B12 in the body. If we have too little vitamin B12, both methylmalonic acid and homocysteine levels rise above normal. Unfortunately, these tests are relatively expensive. Therefore, the economical solution is to simply check the level of vitamin B12, and if the result obtained is in the normal range but is below 400 picograms per milliliter, then higher amounts of this vitamin should be provided. I will now discuss how much vitamin B12 should be consumed. According to official recommendations, adolescents and healthy adults with no vitamin B12 absorption disorders should consume this vitamin at the rate of 2.4 micrograms per day. And this amount would be provided by about 2 eggs, 150 grams of beef, 300 grams of cottage cheese, 3 glasses of milk, or 4 to 10 slices of cheese. The real vitamin bomb, however, is liver. One serving of 100 grams allows you to cover almost 8 times the daily requirement for vitamin B12. However, let's focus on what if we are found to be deficient in vitamin B12. In people who are healthy and do not have malabsorption disorders, but who do not provide adequate amounts of vitamin B12 with their diet, it is recommended to include supplementation with this vitamin in the amount of about 50 to 100 micrograms per day. In contrast, people who suffer from various nutrient absorption disorders, whose blood levels of the vitamin in question are below 400 units, should take about 500 micrograms of vitamin B12 per day, or half a milligram. If you are over 60 years old and not accompanied by the deficiency symptoms I mentioned in this video, and your vitamin B12 levels oscillate below 400 units, then that dose of vitamin B12 or 500 micrograms also seems to be a good option. For people with hypernicious anemia, high doses of vitamin B12 on the order of 1 mg per day or 1000 micrograms should be used. Supplements containing mainly two forms of vitamin B12, methylcobalamin and cyanocobalamin, are commercially available. This raises the question of which form is better. Current knowledge also shows that all forms of vitamin B12 are absorbed at a similar level. However, methylcobalamin appears to persist in tissues to a greater extent than cyanocobalamin. In addition, researchers have some concerns about cyanide retention in tissues after long-term supplementation with cyanocobalamin in high doses. Hence, it is better to choose vitamin B12 preparation that contain methylcobalamin in the formulation. In addition to methylcobalamin, hydroxycobalamin and adenosine-cobalamin can also be recommended. It is also worth knowing that vitamin B12 is very safe for health. As of today, it has not been found to cause any side effects when used in large quantities. Its excess is simply removed from the body without difficulty. At this point, I will still mention that an alternative to oral administration of vitamin B12 is the parenteral route. Vitamin B12 can be used intramuscularly in the form of injections. In this way, the whole complicated process of absorbing vitamin B12 from the gastrointestinal tract is bypassed. Intramuscular supplementation is recommended when vitamin B12 concentrations are very low, and especially when neurological symptoms are present, in which case time and efficiency count. And it is intramuscular supplementation that works quickly and effectively. I hope that with this video I have succeeded in raising your awareness of the dangers of vitamin B12 deficiency. I would be very grateful if you could also share this video with other people, your family, friends, because the problem of vitamin B12 deficiency can affect our loved ones too, and who don't even know about this. To help me reach an even wider audience, you can also click the subscribe button just below this video on the right. Thank you very much in advance. That's all for today's video. Thank you for your attention and see you next time.